So when my patients come in to see me and they're trying to figure out how to have the best outcome from their surgery, I always give them the basics. Number one, if you're smoking, you need to stop, and you need to not try to cold turkey stop, but take medication and use nicotine replacement so that your stop is sustainable. The second thing that I tell my patients is try to stay as active as possible. Exercise right up to the day of surgery so that your body is as fit as possible. There's a lot of evidence that shows us that if patients get up and walk right after surgery, they're going to do their very best. And so I try to get my patients up and moving and active around the time of surgery as much as feasible. The next thing I tell my patients is to focus on their nutrition. They don't want to be in a state where they're breaking down protein, what we call catabolic, right around the time of surgery. We really want our patients to be stable weight or slightly gaining weight around the time of surgery so that their body is ready to build those proteins to heal as quickly as possible after the surgery. Sometimes that means that patients need to take protein replacement shakes, and there are also other immunotherapy shakes, carbohydrate loading shakes, all different kinds of shakes that are out there that are called perioperative shakes to try to give the patient the opportunity to do their best on the day of surgery. Some of the science behind that is not always so clear, but we do always recommend that patients maintain a stable weight, maintain high activity, stop smoking, and do everything they can to educate themselves and their families to have a good outcome. And occasionally, a perfect outcome is not always seen. And that's why it's also important for patients to have a conversation with their family members about what if they have a complication in surgery? What if they're on a ventilator and they're having a hard time weaning? What kinds of outcomes would be acceptable to them? And what kinds of outcomes would not be acceptable to them? And to clearly communicate that with their friends and their family so that the burden of those decisions, if an unfortunate outcome happens, isn't placed on the family and friends, but instead of being on the loved ones, the communication's already happened and they just execute what the patient wanted. The other thing that's very important is to make sure that the patient has somebody with them that is the one single communicator for the rest of the family. That one single communicator can easily and efficiently communicate with the doctors and staff to make sure they disseminate the information to everyone else. Sometimes I could recommend patients set up what's called a Caring Bridge account, which is one of the companies that helps people to have a way of communicating with their friends and family, but controlling the information as it comes and goes and keeps it somewhat confidential as well. And finally, I tell my patients to try to maintain a very good positive attitude. One of the things that I feel the strongest about is having a strong support group and connecting with other people who have same or similar disease is one of the best ways to make sure that you're mentally fit for the surgery. Talking to someone who's already been through the surgery helps you to understand what it might be like. And having people that have already gone through the surgery and they're on the other side of it is a great way to have a team cheering for you that truly understands what you've gone through and truly understands what you need to do to get through it. So build your village of team, support, do what you can to prepare yourself for the surgery, and make checklists. Write your questions down. Make sure your questions get answered. Remember what's important to you and communicate it to your family. I hope that helps.